Hello JMC family, my name is Nurse Cynthia. Welcome to JMC Consult. If you are new to this channel, please do not hesitate to click on the subscribe button, turn on the notification bell so you don't miss out when I post videos. And to my returning subscribers, this is Nurse Cynthia saying thank you very much for sticking to my channel. I hope you find this video very interesting. If you are watching this video, please do not hesitate to like, share and comment. I hope you find this video very helpful. So I made a video about prevention of sexually transmitted infections after unprotected sex. Yes. So, and some of you were requesting that I should make a video on PEP. I should throw more light on PEP. So in this video, we are going to be talking about PEP.
JMC Consult.
Welcome back. So what is PEP? PEP is post-exposure prophylaxis. Yes, post-exposure prophylaxis is a medication taken in order to reduce the risk of having sexually transmitted infections, but not only sexually transmitted infections, that a person could feel the need of having PEP. If someone, for example, healthcare professionals working in healthcare settings who may have had needle stick injury may also feel the need of having PEP. Okay, so when you have needle stick injury and you feel the need of having PEP, you can speak to your doctor. If you think you may have been exposed to disease such as HIV, such as syphilis, if you feel you have been exposed to diseases either through an object that may have been infected, so you may feel the need of having PEP when all of these come into play. So I don't know if I have explained better on the need of having PEP. A good example of PEP is lamivudine. Lamivudine is a good example of PEP. Another example of PEP is Truvadan. Yes, Truvadan. I don't know if I'm pronouncing it very well, but I know it's Truvadan. Truvadan is a combination of amitriptyline, tenofovir, disoprosylfumarate. fumarate. Yes, these are examples of PEP. So this medication must be started within 72 hours after an exposure to a disease. This medication must be started within 72 hours of a potential exposure, but ideally it should be taken immediately. However, it is not 100% accurate or effective in terms of prevention of diseases. It is not 100% effective. So it should be taken for 1 month after the first dose. It should be taken for 1 month after the first dose for it to be effective. So please do not skip a dose or do not double a dose. Yes, please do not skip a dose or double any dose. Please do not skip a dose or double a dose if you miss one. However, ensure you take this medication according to your clinician's advice or according to the written instruction on the medication. So where can you get PEP? You can get PEP for free from the NHS at the sexual health clinic, or you can get it at the local A&E department. How would you know if you need PEP? A person would require PEP if that person has been exposed to an infection or has been exposed to HIV, for example, after sexual intercourse, maybe after unprotected sex, for example. Or not only that, if a person also has been exposed to an infection due to needle stick injury. Like I said earlier, our healthcare professionals who work in the healthcare settings who may have been exposed to an infection due to needle stick injury. So that is an example of a person needing or requiring PEP. Another example is sexual assault. Sorry to say this, sexual assault is another need for a person to require PEP. So PEP helps to reduce the risk of sexually transmitted infections or help to reduce this risk of an infection. That brings me to share a story of my colleague at my previous place of work where she was exposed to an infection due to needle stick injury. Let's call her Sarah for the sake of this video. So Sarah had a patient who was so scared of injections and so scared of needles. So Sarah was able to talk to the patient, try to calm the patient in order to be able to take blood from the patient. So at the process of trying to take blood from this patient, Sarah was pricked by the needle while trying to take blood from the patient. So at that point, Sarah was so devastated. It wasn't an easy experience for her. So a test was quickly run on the patient to check the status of the patient to see if Sarah has been at risk of any form of infection. But luckily for Sarah, she wasn't exposed to any infection, but she was still scared and still felt the need of having PEP. So she had to speak to her doctor in order to know what to do. So when a person have needle stick injury, it's an example of the need for a person to have PEP. For example, after carrying out tests on the patient, if they found out that the patient is having HIV, for example, Sarah would quickly need to have PEP. Example of PEP, like I said, is lamivudine. So Sarah would have that medication in order to prevent the risk of having HIV. How would you know if PEP has failed or worked? PEP has failed or worked in the sense that if you carry out tests on a person after being exposed to an infection, if the test shows negative, it means that the person may have not contracted the infection, or it means that PEP may have worked for that person. But if a test is carried out on that person and it shows positive that the person is having an infection, which means that PEP has not worked for the person, or which means that the person may have contracted the infection. So PEP is not 100% effective. However, it is a means of reducing the risk of contracting an infection. Testing 4 weeks after taking PEP would show 95% if the person is having infection or not. Some PEP are a combination of HIV drugs that can help to stop the virus from permanently entering the body. It can be used after the event of being exposed to the risk of HIV transmission. Post-exposure prophylaxis is a combination of antiretroviral medication used to prevent HIV infection after a potential exposure. It is possible for a person to still contract HIV even after taking it. So it is not 100%. Also, PEP is not a cure for HIV. Note this. PEP is not a cure for HIV. If you are breastfeeding, you can still take PEP. However, your doctor is going to choose a regimen which will be suitable for you and your baby, who might absorb the drug via breastfeeding. So, what are the side effects of this medication? Yes, there is no medication without side effects. However, it varies from person to person because some people react differently to medication. So number one side effect to this medication is headache. Number 2 is nausea. Number 3 is bloating, abdominal bloating. Number 4 is stomach upset. Number 5 is diarrhea. Number 6 is thirst. Number 7 is depression. So these are the side effects of this medication. How would you know if a person may have contacted diseases? For example, HIV. Number 1, the person will start showing symptoms. Yes, the person will start showing symptoms. That is to tell that this person may have contracted this disease. For example, person had a needle stick injury and the person may start developing symptoms even after taking PEP, for example. So what are the early signs of HIV infection? Because HIV is our example of a disease which would require PEP for today. So an early sign that the person may have contracted HIV is fever. Yes, the person may be experiencing fever and the fever will keep coming and without even being resolved. Number two is diarrhea. The person may start having excessive, stooling and even without it being resolved, even after taking medication. Number three is abdominal upset. Yes, stomach upset may be another sign that the person may be having HIV. A flu-like illness that may occur 2 to 6 weeks after exposure. Night sweat is another sign that a person may be having HIV infection. Night sweat. Another one is muscle ache. Another one is mouth ulcer. Mouth ulcer, swollen lymph node, sore throat, headache, diarrhea, fever, rash. If a person is having HIV and started having weight loss, that is to tell that the person's viral load may have increased. So these days, people with HIV now have weight gain. They no longer experience weight loss. However, only few experience weight loss. All of these symptoms are signs that a person could be having HIV infection. However, a person may present with all of these symptoms and still not have HIV. Yes, a person may present with all of these symptoms without having HIV. So, when a person is having HIV, the person can live as normal as those without HIV when the person is constantly taking medication. So if the person is constantly taking his or her medication, the person would have a life expectancy of the same as those without HIV. Depending on the person, it can take up to 10 years for a person to start developing symptoms. It can take up to 3 months for a person to start developing symptoms. So it depends on the person. So many people live with HIV without knowing and also without even presenting symptoms. According to the Center for Disease Control and Prevention, there is no absolute cure for HIV. It can only be controlled, prevented, or managed. So the life expectancy for a person with HIV depends on different factors. Number one depends on early detection. So early detection saves time and it also saves life. If a person detects HIV early on time, the person will be able to manage it consistently with medication. If the person is also eating healthy, it also helps to increase the life expectancy of a person having HIV. So exercise is another thing for the person to also look out for. Yes, if the person is eating healthy and also exercising regularly, it will also help to improve the life expectancy of a person having HIV. And another thing is stopping smoking. So when a person having HIV stops smoking, that would also help to improve the life expectancy of that person. Note, people with HIV who take medication regularly and have access to medical care and also takes antiretroviral medication would have a life expectancy of a person who do not have that disease. Now, let's talk about the guideline for prescribing PEP. In the UK, the HIV and sexual health professionals has produced a guideline about when PEP may be an option for the prevention of sexually transmitted infections. These take into account the type of sex you had and also what is known about the source partner, that is, what is known about the person you had sex with, which is the person who might have HIV. PEP may also be an option if you have used an injecting equipment previously used by someone who might have HIV. This guideline take into account the viral load of a person with HIV if this is known. If a person with HIV is taking his medication, this will help to suppress the viral load of that person to a low level. When a person goes to get PEP at the hospital, that person may need to be tested to know if the person already have HIV or if the person do not have at all. And you may also need to be tested again after 3 months of being tested. You may also need to be tested for sexually transmitted infections like hepatitis B, depending on your situation. So at the initial stage, when you go to test for HIV, it may have not been shown to the professional during the test, but however, after 3 months, this gives enough time for the test to actually show if the person may have been infected. The guideline recommends the use of PEP if a person may have had significant risk of being exposed to HIV infection. So, there are other forms of PEP like doxycycline. Doxycycline is a good form of PEP which can also help to reduce the risk of, contracting infection after unprotected sex. So in some places, it has to be on prescription. You need to speak to your doctor if you're experiencing any sign I mentioned earlier, or if you may have been exposed to sexually transmitted infections, or you feel the need of PEP after being exposed to needle stick injury, or if you have been exposed to an infected object. The use of doxycycline is not 100% guaranteed, but however, it helps to reduce the risk of sexually transmitted infection, and this should be taken within 72 hours of being exposed to an infection or of unprotected sex. There are other types of PEP and other forms of PEP which can be purchased in the pharmacy and around us. But however, before taking any medication, make sure you speak to your doctor so that your doctor will choose the right regimen for you, and also depending on your situation. That brings me to the end of this video. Thank you very much for watching to the end. If you are new to this channel, do not forget to click on the subscribe button. Turn on the notification bell so that you will not miss out when I post another video. To my returning subscribers, this is Cynthia saying thank you very much for sticking to this channel. Please drop your comments on the comment section. I am going to be making a video based on your comments. Thank you very much once again for watching. See you in my next video. Until then, bye.